Today we discuss about equivalent dose, effective dose and absorbed dose, which is used in radiation quantity and measurement. Before we discuss the equivalent dose, effective dose and absorbed dose, we also discuss activity and karma. A unit is necessary for the measurement of any physical quantity. The International Commission on the Radiation Unit and Measurement (ICRU) review and updates from time to time the concept, release to quantity and their units in radiation physics, dosimetry, and radiological protection. Some of the radiation quantity of interest are activity at air karma, exposure, absorbed dose, and equivalent dose. In 1980, the ICRU recommended SI unit for the above quantities. These new units, along with the corresponding old units, are discussed in the following paragraphs. Here we saw the quantity, old unit and new unit. The activity, old unit is CI and new unit is Buccal-Curie. Exposure, Rentgen, new unit is C by kg. Dose equivalent is red or RAM, gray or Sievert, new is. Activity. The activity of a radioactive material is a measure of its spontaneous transformation. It is defined as the number of nucleus transformation disintegration per second. The unit of activity is Becquerel BQ. 1 BQ is equal to transformation per second. The old unit of activity is Curie CI. 1 CI is equal to 3.7 into 10 to the power 10 transformation per second is equal to 3.7 into 10 to the power 10 BQ is equal to 37 G BQ. BQ is 1 CI 1 Curie is equal to 3.7 into 10 to the power 10 transformation per second is equal to 3.7 10 to the power 10 BQ is equal to 3.7 G BQ. Both indirectly ionized photons and neutrons and directly ionized charged particle radiation transfer part or all of their energy when they interact with matter. The unit for the measurement of radiation are based on either the energy transfer by the radiation to matter or the energy absorbed by matter. Next we discuss KERMA, kinetic energy released per unit mass. Karma is defined as the sum of initial kinetic energy of all charged particles liberated by radiation in a material of mass of 1 kg. The unit of karma is joule kg to the power minus 1. The special name for the unit of karma is gray. 1 gray is equal to 1 joule per kg to the power minus 1. Where the reference material is air, the quantity is called as air karma. Then we discuss exposure. Symbol is X. The exposure is a quantity which measures the photon X-ray or gamma radiation flux at a neat point in air. It is defined as the quantity of X-ray or gamma radiation that produced in air ion carry 1 coulomb of charge per kg of air. The unit of exposure is coulomb per, per kg to the power minus 1. Where the presence technique is difficult to measure the exposure, when photon energy involves lie above a few MeV or below a few keV. The old unit of exposure is Rentgen, which is defined as the amount of X-ray or gamma radiation which would liberate 1 ESU of charge of either sign in 1 cc of air at STP. 1 Rentgen is equal to 1 ESU per cc of air at STP is equal to 2.58 into 10 to the power minus 4 C per kg to the power minus 1 in air. Expected from Brasmi lungs at very high energy, the exposure as defined above is the ionization equivalent of the air karma. 1 air karma or gray 1 gray is equal to 114 Rentgen. Dose or absorbed dose. Next we discuss in the dose section absorbed dose. The effect physical, chemical and biological of radiation depend not so much on the energy transferred to medium but on the energy absorbed by it. The quantity absorbed dose or simply dose is defined as the amount of energy absorbed per unit mass of the matter at the point of interest. The unit of dose is joule per kg to the power minus 1. The special name of unit of dose is gray. Symbol is GY. 1 gray is equal to 1 joule per kg to the power minus 1. The whole unit of dose is rate, which is an energy absorbed of 100 ERG per gram of material. 1 rad is equal to 100 ERG gram to the power minus 1. 1 rad is equal to 10 to the power minus 2 joule per kg minus to the power minus 1. 1 rad is equal to 10 to the power minus 2 gray. Expected Brasmi lungs loss at very high energy. The exposure is defined above. Equivalent dose. Effect of radiation depend not only on the amount of energy absorbed but also on the spatial distribution of ion pairs. Hence, the biological damage caused by the same dose of different radiation may different if they have different rate of energy loss per unit path length. Alpha particle, because of their higher charge and mass, cause greater ionization per unit path length than the gamma radiation. One gray of alpha dose is found to be more effective than one gray of gamma dose. Hence, the radiation protection to encounter for the variety of effectiveness of different type of radiation, a factor is called as radiation weight factor, WR is used. Then what is the radiation weight factor? WR for photon is all in all energy range, WR is 1. Electron, WR is 1. Photon and photon other than recoil protons less than 2 MeV, WR is 5. Alpha particle fission fragmented heavy nuclei, WR is 20. Neutrons greater than 10 keV, 5. 10 to 100 keV, 10. 0.1 to 2 MeV, 20. 2 to 20 MeV, 10. Less than 20 MeV, 5. In the radiation weight factor, WR, the equivalent dose is in Sievert is equal to dose in gray into WR. Formerly, the unit of equivalent dose was Rentgen equivalent main RAM. Formerly, equivalent dose is equal to RAM is equal to dose in rate into QF, where the term quality factor was used instead of radiation weight factor, WR. 1 Sievert is equal to 100 RAM or 1 RAM is equal to 0.01 Sievert. Some old in terms of occupational radiation exposure, the gray and Sievert are very large unit. It is often convention to have similar unit by using prefix milli 1000 absorb abbreviate to M, symbol as M, and micro 1 million absorb is equal to U. Similarly, SI unit of activity is the BQ. Compare with Curie, the B, BQ is very similar unit. In practice, it is often convenient to expose the quantity using prefix like kilo, thousand, mega, milli, etc. The multiple prefix are given in the table. The old unit and new unit. Radioactivity, Curie, new unit, BQ. 1 BQ is equal to 0.27 into 10 to the power 10 Curie. Expire is R. R is rentogens. Nu is coulomb per kg to the power minus 1. 1 C kg to the power minus 1 is equal to 3876 rentogen. Rat is gray. New unit is gray. 1 air kerma is equal to 114 rat. R. Rentogen. RAM new unit is Sievert. 1 gray is equal to 100 red. 1 Sievert is equal to 100 RAM. 1 Sievert is equal to 100 RAM. Effective dose. Exposure to radiation may occur to the whole body or the individual organ of the body non-uniformly. Non-uniform radiation have to be restricted in order to protect against not only deterministic effect but also reduced stochastic effect. The ICRP recommend dose limit DL for both stochastic effect and deterministic effect. The exposure radiation may occur to the whole body uniform radiation or the individual organ of the body non-uniform radiation. Non-uniform radiation will have to be restricted in order to protect against not only deterministic effect but also to reduce stochastic effect. The ICRP recommend dose limit DL for both stochastic effect and deterministic effect. Effective dose. Exposure to radiation may occur to the whole body uniform radiation or to individual organ of the body non-uniform irradiation. Non-uniform irradiation will have to be restricted in order to protect against not only deterministic effect but also reduce stochastic effect. The CIRP recommend dose limit for both static and deterministic effect. If several tissues T1, T2, T3 individually receive equivalent dose of H1, H2 and H3, then the total risk to the individual should not be exceed the result from stipulated dose limit of uniform whole body irradiation. A number of organs are considered on the basis of their radioactivity and their risks. Risk factors are age and sex dependent. Depending on the extract which risks from stochastic effect in a tissue organ may contribute to the total risk. Stochastic effect, a weight factor called the tissue weight factor T1 is assigned to each tissue organ. T1 is represented in the contribution of tissue T to the total risk due to the static effect from non-uniform irradiation of whole body. T2 values are useful in converting equivalent dose received by one or more organ, partly body exposure, to effective whole body exposure equivalent. The quantity is to be used only for establishment of static effect of radiation protection purpose. Tissue weight factor of organ gonads 0.20, bone marrow 0.12, bone marrow is red bone marrow is 0.12, lungs 0.12, stomach 0.12, bladder 0.05, liver 0.05, thyroid 0.05, esophagus 0.05, bladder 0.05, breast 0.05, skin 0.01, bone surface 0.01, remaining all organ 0.05. For diagnostic X-ray, one retrogen exposure delivered in a dose of about 1 rad and an equivalent dose of 1 rem to muscle tissue. Here this and other useful definitions like dose rate received in a given time, dose rate is equal to dose per time or dose into time. Particle fluence or photon fluence, particles divided by centimeter square or photon divided by centimeter square. Particle flux or photon flux, particle flux rate, particle by cm square or seconds, or photons cm square or seconds. Energy fluence, energy per centimeter square. Energy flux density or intensity, energy flux rate is equal to energy divided by cm square or centimeter square per seconds. For diagnostic X-ray, one Rentgen expert delivered to a dose of 1 rad and equivalent dose of 1 rem to muscle tissue, which is already repeated. Thank you for watching. This video is about absorbed dose, equivalent dose or effective dose, and also include activity